So let's talk a little bit about some of the mechanical changes that can happen. Some of the increased pressure, the shifting in weight, the spine, let's talk about all of those things as it relates to the pelvic floor in pregnancy, and then what we can expect postpartum after childbirth.
Yeah. So pregnancy and childbirth are definite known contributors to increasing our risk of experiencing pelvic floor dysfunction or challenges like incontinence and prolapse, chronic low back pain. And part of it is biomechanically. So our posture changes. As a result, we have increased size, most people, in their breasts. Sometimes we get more rounded in our shoulders. In our abdominal wall, obviously the belly starts to grow out in front of us. We have the 2 six-pack muscles in the abdominal wall. Those are our outermost abdominals. Those are joined, held in place at the midline by a connective tissue called the linea alba. And that linea alba faces stretch as the belly grows. And sometimes the rectus will move away from the midline. So that can alter our core control mechanisms. Also, the underlying abdominal muscles are also experiencing stretch and sort of displacement, I guess is a word we could use. Our center of gravity shifts. So now the way that we start to hold that weight. So sometimes it's very common to see pregnant people that are waddling, and they often have their upper back is sort of leaning back and their pelvis is almost thrust forward, and they sort of do this little waddle. Sometimes it's because of discomfort and pain, and sometimes it's because that's the position that they have adopted to almost counteract this center of gravity, this growing belly that's out in front of them. And that can then result in altered breathing mechanics. It can create more discomfort in the low back. We even have research to say that pregnant women have more back pain than non-pregnant women. And I don't know if we necessarily needed a study to confirm that, but it's true. And that's what we do.
Yes. Yeah.
So, and then the muscles, the pelvic floor muscles, those alterations in how we're carrying our weight also alters the way that our pelvic floor muscles are functioning. And oftentimes they start to hold on to more tension. So part of it is because of the relationship between the diaphragm and the pelvic floor starts to shift a bit because of that change in our posture. Sometimes it's because maybe we're sitting more or sitting in different ways because we're trying to manage pain. But those are the most common. We also experience the hormonal fluctuations that can contribute to some discomfort, pregnancy aches and pains, most specifically in the pelvis and in the in the low back. So pelvic girdle pain, pregnancy-related pelvic girdle pain, especially in the pubic joint at the front, the tailbone, and also the SI joints in the pelvis. So SI joints here at the back, we have 2 of them. We can have tailbone pain down here, and we can also experience pubic joint pain at the front, partly because of the hormones, but then also we have an additional weight. So we are carrying this ever increasing load as the baby grows, potentially babies, that's not only shifted our center of gravity, but the muscles need to carry that load as well. And if they're not in their ideal optimal position, then other muscles will maybe start to overwork. So sometimes the posterior pelvic floor starts to come in a little bit more, but then also the glutes start to become a little bit inhibited. So you see in pregnancy, it's not as, visual, partly because we typically carry a little bit of excess weight. But once people have given birth and the weight starts to come off the body, if you look at the back sides, like the butts of new moms, they're often very flat and sort of tucked under. And part of that is because their body has adapted to that shifting center of gravity. And then once the baby's born, they don't just let go. The body has adapted to that new state. And there's often a lot of tension in that pelvic floor, which we want to address when we're pregnant because that can hinder us during our birth. And we want to make sure that we address it afterwards because that's a contributing factor to the lingering things like incontinence and prolapse.